Hey there, it's Ted here. A huge thank you for your interest in our online training, Beyond Physiology, a new lens for persistent plantar heel pains. It's happening this Thursday evening. We've had a lot of great questions, a lot of interest come through, so I thought I'd just take a minute to clear a few things up. Okay, first up, is this something to do with FMT? No, it's not another FMT course or manual therapy protocol. What we're doing here builds beyond that. We're looking at the latest brain and system science that changes how we think about pain itself, not just how we load or mobilize tissues. Is it like anything we've trained on in the past? The answer, no. Beyond Physiology looks at what we do when the pain keeps persisting even after you've ticked every treatment box. We're going to look beyond the symptoms and see pain through a new lens. So what does it actually mean to go beyond physiology? It doesn't mean physiology doesn't matter, it absolutely does. But in chronic or persistent pain cases, physiology is just one part of a much bigger system. Going beyond physiology means identifying when plantar heel pain is no longer a simple tissue issue and what to do to help patients from that point on. Because sometimes the tissue is healed, but the pain signals continue. We'll explore what's missing in your plantar heel pain approach and give you the tools, templates, and frameworks to no longer feel empty-handed again. You'll be able to apply what you discover immediately. Next up, why aren't you teaching another treatment option? Well, look, this is because the problem isn't that we need more techniques. It's that we need a better framework for deciding when, how, and why to use the ones we already have. Next up, will the training be recorded? Yes, it'll be recorded. When you enroll into the training, you'll see how you can get the recording if you can't be there live. But you'll get the best value by being there live because it's going to be an interactive event. Your questions, of course, will be most welcome. Finally, what do we actually mean by persistent plantar heel pain? We're talking about pain that's lasted longer than 3 months. In other words, when you ask your patient, how long have you had this pain for? And they respond with any time that's longer than 3 months, the research tells us we must look beyond the physiology of the painful tissues. This also applies to recurrent heel pains and heels that are non-responsive to the standard loading mechanical protocols. That's when physiology alone stops explaining what's happening and where this new lens starts making a real difference. So if you've a heel pain case, it's been around for longer than 3 months, and you need a clear, evidence-informed way forward, you'll love this training. It's practical, it's clinic ready, and it'll change how you think about stubborn pains forever. Can't wait to see you on the next Tuesday night for Beyond Physiology. Seats are filling up fast, so don't miss out. Book your seat and come ready to see what's truly possible when we move beyond the mechanical into the multidimensional. See you there.